As we approach the end of Suicide Prevention Month, this Advancing Health podcast is focused on AHA's Hospitals Against Violence, or HAV initiative, which provides tools and resources to hospitals and health systems combating violence in the workplace and in the communities they serve. Part of the focus of HAV is taking a public health approach to addressing gun violence, and today's podcast explores the role of healthcare leaders in suicide prevention. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly with AHA Communications. In this episode, Laura Castellanos, Associate Director of AHA's Hospitals Against Violence Initiative, is speaking with Dr. Emmy Betz to discuss the importance of firearm safety and its role in preventing suicide. Dr. Betz is a professor of emergency medicine at the University of Colorado School of Medicine, as well as director of the Firearm Injury Prevention Initiative at the Injury and Violence Prevention Center. She's also a founding member of the Colorado Firearms Safety Coalition. Let's join them.
Thank you for listening to this AHA Advancing Health in America podcast. I am delighted to be joined by someone I've admired since watching her TED Talk on how to talk about guns and suicide, with over 14,000 views. She discusses how her work has led to researching suicide prevention and how we all need to be talking about suicide. September is Suicide Prevention Awareness Month, so we want to take this opportunity to talk to Emmy Betz about how we can all save lives. Thank you again, Dr. Betz, for joining me today.
Thanks for having me.
Absolutely. So let's begin. Let's begin our time by having you share more about your work in firearm injury prevention and suicide prevention, and how that research has led to building of coalitions.
Yeah, well, thanks. I guess if I start where I'm at now, then we'll maybe work backwards in how we got here. I feel really fortunate now to be the director of the Firearm Injury Prevention Initiative at the University of Colorado. We really seek to use collaboration and research and education to help prevent all types of firearm injuries. But a lot of my own work has really focused in on the firearm suicide space. And I think that's where a lot of the collaboration and coalition building came from. I wish I could say that it was all a very linear process, but it's been, I think, a lot of hard work and luck over the years in meeting some people who really were excited to do this kind of collaborative work. And over time, as we built up trust and relationships, then it's really led to a career that is, I think, more exciting and fulfilling than I ever really could have hoped for. So I think it's a really exciting space to be working in, because these injuries and deaths, especially suicide, but really all injuries and deaths, nobody wants them. And I think we get so caught in the political battle of people yelling at each other that we forget that core point, that we all want our families to be healthy and happy and safe. And we may not always agree on how we get there, but I think that core message is one that can really resonate with us as clinicians.
Part of what you talk about is sharing more about how firearms really play a role in suicides and how we should be able to be talking about it. And then you get specific, how access to guns increases the lethality of suicide. So let's talk about that. How, as we're talking to healthcare leaders and clinicians, providers, in the field at large, what should we know about asking these questions, and what steps can we take?
Yeah, great point. And I want to start by also pointing out that I think sometimes in a clinical space, we forget about firearm suicide because we don't see it. Because unfortunately, people who attempt suicide using a firearm generally die and don't make it to the hospital. And so it's not sort of right in front of us the way other gun-related injuries are. And so I think sometimes as clinicians or as hospital administrators and so forth, it's just, we don't really realize actually how much we can be doing. So thank you for the opportunity to help raise awareness about this. So the good news is that suicide is preventable, particularly firearm suicide. And That's because of generally three kind of big facts. So the first is that the time over which someone is most at risk of suicide can be very short, actually minutes to hours. That means we know from research that the time from deciding to take action to actually attempting suicide can be very brief. So when we're thinking about how to keep people safe, meaning not having access to dangerous things, we're not talking about years and years. It's really this high risk period. Of course, we need to then help them get the treatment they need, whether for substance abuse, mental illness, and so forth. But it's really about keeping the environment safe during a relatively short period of time. The second thing is that suicide is not inevitable. So we know that from studies that over time, less than 10% of those who have suicidal thoughts or behaviors or see a physician for self-harm later die by suicide. So it's not inevitable. I think we need to kind of, in healthcare, we still share that stigma that somehow there's nothing we can do. No, suicide is preventable. Most people don't later die by suicide, even after an attempt. So we need to help people get better. And the third really important thing is that firearms are uniquely lethal. They're supposed to be. I mean, that's what they're intended for. And so if someone attempts suicide with a gun, about 90% of the time they will die. And that's a much higher rate. That 90% death rate is much higher than for medications or other methods of suicide. So if there's no access to a gun and someone was planning on using it, we know in many cases that they actually just won't attempt, that the period of crisis will pass. Even if they attempt, and again, most people don't substitute a different method, but even if they did, even if, say, they took pills instead, they're much less likely to die. And so in that sense, it's sort of like wearing your seatbelt when you're in the car. It might not, prevent the other situations, the crash from happening, but it's going to save your life. So it's really those three things: that periods of suicide crisis can be short, that most people get better, and that guns are uniquely lethal. Because of those things, that's why we really need to be talking about and taking actions to reduce access to guns for people who have suicide risk. And by taking action to reduce access, I really mean engaging the person and their family and friends, ideally in voluntary changes. I'm not talking about confiscation. I'm not talking about legislation. I'm talking about how do we work with patients and their families to make environments safe during high-risk times.
Thank you for that. So let's talk about, making the environment safe. And this is where the public health approach, what we've learned, you mentioned, car crashes, will help inform what questions we ask, what solutions work, perhaps what also research needs to happen. But as we're talking, to healthcare providers right now in the field, seeing these patients every day, what should they know about safe storage? What can they look for, to be informed and to be able to feel confident when asking these questions that they can create a safer environment?
Yeah. So first off, I don't think you need to be a gun expert. I don't think you need to know all the ins and outs of different storage devices. I don't think you even need to know different types of guns or how to shoot them or any of that. I think what we as healthcare providers need to do in this situation is what we do in almost every other situation, which is provide patient-centered, non-judgmental, engaged care. So the same way that we talk about exercise or sexual practices or substance use, all of those things that we talk about in different contexts, this is really the same thing. And we may not be the same as our patients. I care for people every day who are very different from me in all kinds of things, in gender and age and religion and so forth. But I always try to meet them where they're at and find a way to support them in making the choices that are going to be healthier for them. And that's really what we're talking about here too. So specifically, if you have a patient, if you're caring for someone who has some suicide risk, so maybe it's that they've said, I'm suicidal. Maybe it's that they have depression or pretty significant depression or other mental illness. Maybe they have bad substance abuse or just a lot of life stress or something's going on where you're worried about them. Generally, it's about talking about access to lethal methods. And the way I do that is after I've built that rapport, I've been talking to them and sort of doing a risk assessment. And I work in the ER, so I see lots of people with risk. Generally, I'll say something like, whenever I'm caring for someone who's at risk of suicide, I want to do what I can to help make their environment safer. Do you have access to any guns at home? So I don't ask actually if they own, because I don't care if they own or not. It's really more about, do you have access to things? And I think if you do it in a way that is non-judgmental and provides for dialogue, generally I feel like people have been really open and okay about that. I've never had anyone get really angry at me. And then if they say yes, then it's about, okay, well, what kinds of things could you do to reduce access while you're getting better? And what that can mean is locking it up differently at home so that only someone else has access. So maybe the spouse still can get access, but the person with suicide risk can't. The safest option is really to move guns out of the home. And that can vary, and options vary a little bit in terms of state law. So you can't always just give guns to other people. So I don't recommend saying, well, just give it to your neighbor, because that might actually be illegal. So, and that might, a gun owner usually will know the laws. But if you're not sure of your state laws, you can always say, well, or would you be willing to think about storing it off-site for a while, maybe at a gun shop or at a self-storage unit? Or if you know your state laws, then you could talk about, could your sister or brother hang on to it and so forth, depending on what's legal. So it's really about just reducing access to that lethal method. You can also talk about medications. I already said medications are not as lethal as guns, but with patients, sometimes I think they appreciate the additional context of like, let's think about all the potentially dangerous things in your house, because then it can feel a little like you're not just picking on the guns.
Thank you for that. That's great insight and context. For someone that's not a clinician, that those encounters, it's so key to being able to connect to the patients and ultimately to the community. So it's good to know where we can support each other in creating that and fostering that environment.
I have one other thing to add, I guess, just some more specifics about language, because when I started doing this, I really got hung up on like what words to use and like how to ask. I think generally you want to avoid words like confiscate or, removal, like things that imply somehow legal intervention. We also generally, people do talk about so-called red flag laws and extreme risk protection orders. Those are kind of an extreme option where there's somebody with a lot of risk for suicide or homicide and they're not engaging themselves. So in these initial conversations, it's really about you and the patient and ideally their family members kind of working together. And so you can say things like, this is about decisions you can make, and just really to support them in feeling comfortable, and that these are voluntary actions that aren't getting somehow recorded with the state and so forth. I think that can sometimes help people feel a little more comfortable.
Thank you, and appreciate you sharing, as I know we're all learning together. So to that end, what would you like for healthcare leaders that are trying to support efforts around suicide prevention? What should they know about firearms and suicide that can help them save lives in their efforts?
The first thing I'd say is that this is something we have to be doing, and this is not political. Nobody wants these deaths to happen. People who own guns don't want suicides in their families. I think we in healthcare have an obligation to make sure we are educating our patients, working with our patients to help them be safe. And I think if we as clinicians and as healthcare organizations are not doing everything we can in that space, particularly in the education space, that we are really missing a key opportunity. And I think it's not political. I think it's really important to emphasize that we can be working with our patients, educating them, providing locking devices, providing links, sort of community resources where they can store guns. And that has nothing to do with gun control laws or promoting Second Amendment rights. I mean, it is a non-political health action. And I absolutely think that we should be engaged in it, and that it, again, can be non-political. If we're not doing it, we are somehow implying that those suicide deaths, I think, don't matter. And they do matter. Those are lives lost and people grieving, and we can do more to prevent those deaths.
Thank you for that. And kind of continuing on things to consider, the role that mental illness plays in just the overall conversation regarding violence. You mentioned both homicide and suicide, access to firearms relate to both. So what should healthcare leaders know about the role that mental illness plays, and how can we be aware in ensuring that there's no bias in our efforts to keep people safe?
Yeah, thank you for asking that. So it's really important that we remember that individuals with mental illness don't pose a significant risk to the people around them. If there's violence related to mental illness, unfortunately, it's usually suicide. And again, we've been talking about that those are preventable deaths, and we should be doing everything we can to help and to prevent those deaths. But we need to really fight against any stigma or stereotypes that somehow people with mental illness are dangerous to society. In fact, people with diagnosed mental illness often have made the brave choice to seek help. We know there are a lot of people out there struggling with depression or other mental health problems who don't have diagnoses yet because there's so much stigma around help seeking. So I think we really need to normalize that mental health, mental wellness, mental illness are the same as physical health and physical illness. There's something all of us have from time to time. There's something that we need care for, we need treatment for, and that people get better. So that's why I've been talking about voluntary options. I am not talking about, sort of approaches where someone who had a period of depression can never own firearms. We really need to guard against things like that, because people who have periods of depression or other mental illness and get better, we need just to make sure that there's not this sort of long-term stigma against them. Certainly there are people who have significant lifelong mental illness where they may not be safe, for example, to own firearms, but that's really a different issue than what we're talking about here today in terms of general suicide prevention.
Thank you so much. No, I'm thoroughly enjoying this conversation. I'm so glad that we get to share with our audience what you know, what you've learned. So thank you again for sharing your insight. It's quite helpful to help leaders understand where they can make an impact and take action. So before closing our time today, just a quick takeaway as an actionable next step for healthcare leaders. And again, we're building awareness, but we also want to create change. We mentioned a lot of really important topics. So anything you'd like to share?
So I would say, I really hope that healthcare organizations will get involved. I also hope you don't start from scratch. There are great resources out there, and I think this is a space where you do want to be careful about language and training and sort of doing it right. And so I would encourage people who are interested to look for those resources. And I hope we'll put some links in the show notes so that you don't have to start from scratch, and that you can ideally be using sort of best practices. And I think really then in some ways that the sky's the limit. There's really interesting things happening where people are trying out partnerships with local retailers or supporting secure storage, giving out locking devices. There's lots of, I think, open questions about how we really do this best. And so I encourage people to get involved, because suicides account for the majority of gun deaths in this country. And on the flip side, over half of all suicides are by firearm. And so we have to be talking about this. And there's a lot we can do, and I encourage people to get involved.
That's exactly what we did today. We talked about it. So much great information. Thank you again, Dr. Betz.
Thank you so much. And I did have one last thought, which is that we in healthcare need to look out for ourselves as well and recognize we're at risk for suicide, unfortunately, and many, many people in healthcare own firearms too. So this work is important also for taking care of each other.
Thank you for that. And you mentioned links and sharing of resources, and that's exactly what we have been doing. Our AHA teams are working on bringing together those resources, so we'll add those links. So thank you again, Dr. Betz. We are so glad that we'll be releasing this podcast along with other suicide prevention resources during the month of September, so we may continue to raise awareness and work towards preventing suicide together.
Thank you so much.